Okay, so we are live. Hi, Mario. How are you doing today?
Hi, Cynthia. Yeah, I'm good. How are you?
I'm all right. I'm fine. How is it at your end?
Yeah, pretty good. It's a Friday. We're in near the end of the weekend, so yeah.
Yeah, of course. Okay, so can you introduce yourself for the people that would be listening to this video?
Yeah, hi. I'm Mario. I am a North London medical physics trainee specialising in imaging with non-ionizing radiation.
Okay, so can you talk to us about your pre-STP background?
Yeah, so I grew up in London, which wanted me to come back to London for the STP, and I went to university and did a integrated masters in physics at the University of Nottingham, and after that I went straight into the STP. Between my third and fourth year, I did an internship at a medical technology company which specialised in AI for MRI. So that's where I sort of wanted to go into medical imaging and medical physics. So I applied to the STP from there and got in, and I'm part of the North London Training Consortium. So employed by Imperial, but I'm doing my specialist training at Bart's Trust.
Yeah. Okay, so that means you went in straight for non-ionizing and not the medical physics. What do you guys call it? The
It is undefined yet. So you can, when you apply, you can specify which one you want to go for. As I'm from North London, I wanted to train in North London. The only places available were for undefined for medical physics. So I had to apply through that. I sort of already knew I was going to pick imaging with non-ionizing, but I've had to go through the undefined route and then pick my specialism after.
Yeah. Okay. So since you are part of a, is it, did you say consortium? Yeah.
Yeah.
Yeah. Okay. So for you guys in that type of setting, how do you pick your specialist? Because I spoke with Maya and she mentioned something about kind of the slot being competitive or something. Do you guys I don't know, how do you guys get to pick your
Yeah. Yeah, it's quite interesting. So the North London Consortium consists of 6 trusts, and so in our first year we do our rotations in um, diagnostic radiology, non-ionizing, um, radiotherapy, nuclear medicine. So we do all of those, and then when we choose our specialism, depending on the number of places that each consortium have, then people get allocated that way. Previously, people have had to interview if there's been too many applying for one. In my year, luckily that didn't happen because one, the places were spread out enough, and two, we had someone go to South London because the South London also has a consortium, and then they can work together to sort that out sometimes. But it's not guaranteed that you get your first choice nominally. It just did happen in my.
Okay, that sounds interesting. So, can you talk to us about your specialty then?
Yeah, so imaging with non-ionizing radiation is a mixture of MRI, ultrasound, and lasers. It is about 65% MRI in terms of competencies and things like that, and probably about 30% ultrasound, 5% lasers. There's not too much laser stuff we do. But yeah, I'm really enjoying it. I would obviously say it's the best medical physics specialism for everyone would say that. I quite like how research heavy and coding heavy it can be if you want it to be. And yeah, that's one of my favorite parts of it.
Okay, so when you say research heavy or clinic heavy, does that mean you get to decide how you want it to be?
Well, mostly it depends on your department. Departments are run very differently, especially in MRI physics. Some of them have external contracts where they go and do QA and other stuff for private sites and things like that. Some bigger trusts that have many multiple sites mostly do clinical work, but then also have clinical research projects as part of. Sometimes they're funded by a trust charity or by other grants. So yeah, it really depends on the department, but also as a trainee, you're given a decent choice of how to take it basically, and then what to do with your MSc project. So that's good.
Okay, sounds interesting. So, you just said your specialty is the best, and when I spoke to Maya, she also said her specialty is the best. So, yeah. So, what would you say is the role of a clinical scientist specifically in your specialty? Because for some applicants that will be watching, they are usually asked what the role of a clinical scientist in medical physics is. So, yeah, what would you say is the role of a clinical scientist within your own medical physics specialty?
Yeah. Okay. Well, first I'll clarify and say that my specialty is the best for me. So I think it needs to be a bit diplomatic and whatever. But okay. So The role of a clinical scientist in MRI, especially, which is what you'll mostly be in an MRI physics team in a imaging non-ionizing specialism. Massive part is to do with implant safety. So we get requests from our superintendent radiographers saying, "Oh, we have a patient that's turned up. They have this implant. What should we scan?" And there's 1,000,001 implants with all different conditions for scanning, and it gets very, very complicated, and that's why it takes up quite a lot of time. Writing SOPs and implant policies and responding to those requests, and also sometimes going to scans and helping to optimize the scans on the fly. That's a fairly big role. As with any medical physics specialism, being involved in the equipment lifecycle, so before acceptance testing, regular QA, and decommissioning is a massive part. I think in MRI as well, there's a lot more. I mean, there is a lot of clinical research in other areas as well, but a lot of MR physicists come from academic backgrounds. A lot do come from STP, but a lot are root to an academic background. So, and they usually merge in previous. So there's a lot of clinical research and non-clinical research as well. So yeah, what am I missing? I don't know what I'm missing, to be
Yeah,
honest.
talking about MRI. I saw in the news recently about about the man that was did I say hospitalized by an MRI machine or whatever. So are you guys also involved in the safety part of it, or is there a different specialty that takes care of that?
So yeah, so that's a good prompt, because alongside with implant safety and whatnot, there's also writing local rules and putting in safety procedures for the department and the areas themselves. And that's audited by us as well. So we'll do safety audits every year for each site and then follow up every 6 months after. And that would be looking out for that sort of thing. So yeah, that was a tragic accident happened in New York. So this is the thing. When people look at medical physics specialisms in imaging, they look at CT, they look at X-ray, they say, "Oh, there's ionizing radiation, it increases your lifetime risk of cancer," and so on.
Yeah.
And that's obviously true, but it's seen as inherently more dangerous. Whereas people have actually died in MRI from projectile incidents and things like that. So what happened was there was a claustrophobic patient that was shouting for her husband. Her husband was outside, but very close to the room where he shouldn't have been. And he ran in to help his wife, and he had a very heavy chain around his neck, and he was pulled in by the machine. And for whatever reason, the machine didn't quench. You can, because they say the magnet is always on. The magnet is always on, but it can be turned off if someone is stuck to the scanner or something big is stuck to the scanner. You can press a quench button to boil off the helium, and that means the magnet loses its superconductivity and eventually would ramp down to a much lower magnetic field to get the person out or the object out. For whatever reason, that couldn't happen. So the guy actually died the day after. So when it comes to safety audits and writing policy, you're always trying to reduce that. But yeah, there's a lot of risk with MRI when it comes to, I mean, when you don't have safety policy in place. So you have projectile incidents like that when large ferromagnetic objects are brought into the room. So you do everything you can to stop that. Usually that's not having anything ferromagnetic that's even in the surrounding areas, having everything labeled and whatnot. Then you can also have incidents to do with excessive heating, because when you have an MRI, you have radio frequency pulses basically blasted into the body. And this is fine. It doesn't usually heat the body up much, or it'll go up to like 1 degree maybe at most. But if you have a current loop, so if there was a ECG electrode and a wire, that would heat up because it would create a conducting loop. There was an incident a while ago. I don't know if this was America or the UK or somewhere else, but there was a baby in an incubator being scanned with a pulse oximeter on their finger, and it was under the blanket. It wasn't an MR conditional one, and that caused a burn so bad that it had to be amputated. And I think that had to amputate the hand as well. So it is really serious, and obviously there's more inherently risky scans than a routine knee scan or a head scan. When you have someone under general anesthetic, you have a lot of equipment that needs to be brought into the room. This equipment is different than usual. Like if you're getting a CT scan under GA or like a surgery or something, like the ventilator, the infusion pump, and the anesthetic machine itself and the monitor all have to be specially made to be MRI conditional, and so that makes it inherently more risky. Yes, a bunch of different policies, and
Yeah,
it's
that's
yeah, it can be scary.
Yeah, it sounds scary. I'm genuinely scared of medical physics. I spoke with Maya. She told me so many things about nuclear medicine, and I was genuinely scared. But yeah, it's
Yeah, it's a different. This is the thing in medical physics. There's different types of risks. So you have in CT and X-ray, you have overexposure, and you're increasing someone's lifetime risk of cancer. In nuclear medicine, you have like radioactive spills and things like
yeah,
that. For me, that's the most scary. When I did my nuclear medicine rotation, I didn't want to go near anything radioactive. It feels because it's something that's very invisible, and you sort of see it.
yeah,
And I think the invisibility of like it's not like a train is coming towards you or you're standing on the edge of a cliff. Like when you have an X-ray or you're injected with something radioactive or you're going into an MRI room, you don't necessarily see an inherent risk, and that's what makes it. Sorry, you don't see a hazard, so it makes it more risky, I think, and probably to the average person, it's more important to make them more aware of things like that. So yeah, there is
yeah. But
that's just
it's also yeah. You already mentioned that you attend King's College. So are you currently in second year or third year?
I'm in second year.
Okay, so what kind of stuff are you currently going through right now? Because I know maybe second year you're already preparing for third year, dissertation, projects and all that. So what kind of things are you up to right now?
Yeah, so in medical physics in the first year, you do a very general introduction to medical physics course that covers all specialisms. And then you do a second module, which is like a lit review and a bit of stats course, which everyone does. Specialism in second year, you do a specialist module, which is basically like going beyond the sub module of last year. So I had like MRI and ultrasound and a few laser lectures that lasted about a month. And then that I had one exam. So in imaging and non-ionizing radiation, in the specialism, you only have one exam, which is lower than all of the other ones. I think you have at least two in every other specialism and sometimes three. They changed the course in King's slightly this year. So I don't know if I can comment for what they'll do next year because it changes all the time depending on feedback, which is positive because turns out they listen to us. We had our third year taught modules taught to us immediately after our second year modules, and that was all coursework based. So we had sort of like a not introduction to MRI and ultrasound, but sort of a semi-advanced intermediate level, and then we did advanced MRI after and a coursework on that. And I'll have one more coursework on ultrasound. As for MSc project, I've got my interim report due in a couple months, and everyone in medical physics started that about a month ago.
Okay. So yeah, when you say interim report, is that what you do for second year, like the proposal, something?
Yeah, so you do a proposal for first, and it's very, very short. You just write a short outline. It's like 250 words of title of your project, like little background on what you're going to do. The interim report is a scaled up version of that, and it's formative. It's not marked, but you have to say basically a short background, what you've done so far, what you're going to do, and then future work after / discussion.
Yeah.
So yeah, I'm currently working on that, but I'm mostly just focusing on the work itself rather than the report because that's more important.
Yeah,
But
I
yeah,
get.
that's something everyone's doing in medical physics.
So how did you pick your project topic? Does it get assigned to you by the trust, or do you find something you're interested in?
Yeah, it's a good question. Technically, you can pick whatever you want. Typically, in a department, sometimes they will give you a list of things that people in that department are working on where there's an MSc project they can make for you. And that's really handy because you can work with someone that has experience in that area that you already know and you're already familiar with. In my case, I'm basically extending work that's been done at my trust for a while, which is a real-time MRI of speech. And that's a big research area that my team have been working on for a while. Also, you don't need to do it locally. Well, you will have local supervisors, but you don't need to go through your local supervisors to pick a project. You can go through your university. So I know people that couldn't find a project they wanted to do when talking to their local supervisors and training officers. So they went to King's and said, "Oh, I want to do susceptibility weighted MRI imaging or something." And then they had a meeting with an academic there and made a project like that. So it's quite open ended. You need to be quite proactive if you want to decide something that you want to do that's not presented to you. It's not like when I did my integrated masters, there was a list of about 100 projects that everyone was given, and then we ranked those. It's not you have to go and have discussions with people, find out their research interests if you want to go through the university. But yeah, I'm very happy that I'm doing mine with my trust because there's people that have big experiences in it and still work on it, and they can help me a fair bit. And yeah, I'm sort of contributing on the back of their work before. So yeah, that's really nice.
Okay. So let's talk about what a day in your life is like. So as a trainee in non-ionizing, so what's a typical day in your life like? Or if a typical day in your life would not cover that, let's say a typical week in your life like as a
Wait.
trainee.
Yeah, so it's very varied, especially because I'm working at Bart's Trust. There's 5 different sites, so technically I can be on any site on any day. Another classic feature of MRI compared to other medical physics specialisms is that there's usually more working from home.
Okay.
So I'm usually working from home about 2 days a week. When I'm doing that, I'm usually writing up competencies or doing project work. I don't have an organized study day or anything like that. I just sort of do it all together. I could talk about today. Well, today I'm doing this with you, but earlier I went into the hospital just to access packs because there's been some weird artifacts happening. I've been looking to investigate that. So what would happen is I'll bring up a patient's images, look at the artifacts, and then maybe go and do QA tests on the coil and try and see what's wrong with that. There's also a couple clinical projects I'm working on. So I'm working on one for AI reconstruction being used in prostate imaging. So I would have meetings with the radiologists maybe and help talk about that project. Sometimes you have safety audits. Depending on how many sites you do, that can vary. That you might only have to do one a month or one every 2 months. So sometimes I'll do that. Oh yeah, I'm also delivering ultrasound training to imaging assistants at the moment. So people that work in theaters, they're sort of they'll come in, they'll clean equipment, they'll hand stuff to surgeons and things like that. So I'm doing some CPD physics and safety training, but also a probe care thing because it's very important to um, obviously minimize infection and whatever to not harm the patient, but also to not unnecessarily break equipment that's very expensive. Like transesophageal echocardiogram probes are like upwards of £10,000, £20,000. So and they're quite easily broken. It's just so I'm trying to help guide them on probe maintenance and things like that. So that's an ultrasound. In MRI, there's also a fair bit of training, so contingency training and safety training for radiographers is also very important. And yeah, it's quite a fun part. I like talking to people, so yeah, I like that as well. Yeah, it's a bunch of different jobs that you have to do semi periodically. It's not very routine. Like in radiotherapy, you might say, "Oh, I'm in planning for 2 weeks." And I'm just working on plans, and then I'm on QA for 2 weeks. I'm working on QA, and there's things that crop up all the time. Sometimes you might need to attend scans to help with safety or help with optimization, as in to reduce the risk of implant heating and things like that. Yeah, so it's very like no week is the same or repeated, if that makes sense.
Yeah, that makes sense. So the bit of working from home you talked about is also applicable for registered clinical scientists because I know you mentioned earlier that they write SOPs and they have like bit of research and all that. So do they also get the opportunity to work from home as well, or is it just for trainees?
No, this is everyone. This is everyone in the team. So yeah, I mean, I think it's pretty typical in a few teams that I've seen to work from home like 1-2 days a week.
Yeah. Okay.
Yeah, it really depends. It's also depends on your office situation, your department, your leadership, things like that. So it's not a prescriptive statement I can say for everything, but it's known there's a tendency for MRI physics teams to work from home more than, for example, nuclear medicine teams that need to be there all the time, radiotherapy teams that need to be there all the time.
Okay. Sounds interesting. I think I'm liking the MR.
Yeah, it is good. I think I managed to get a lot more of my work that I need to do when I'm from home, like my competencies, my write-ups and things like that, because I can wake up early, not worry about traveling there and
Yeah.
back. Yeah, so I quite like it. It suits me. There's a lot of people that absolutely despise working from home, and that's completely fair. And this it's not like you're forced to work from home if you don't want to. You can come in every day. It's fine. No one's going to.
I think it's good to have that flexibility. If you feel like you want to go in, then you go in. But sometimes when you're at home, you're kind of more productive, especially as trainees, where you have a lot of competencies and project and lots of writings to do. So if you have the opportunity to be flexible, then why not? I'll definitely take it.
Yeah, yeah, it's good.
Okay, let's get back to where it all started from the STP application. So, can you tell us about your STP application experience?
Yeah, so I went in very blind, I'll say. I didn't go to any open days. I didn't look online for much. I was applying to a lot of jobs at the time. Most of them, STP was what I wanted to do, but I would have happily gone and done like a data analyst or data science job and then reapply the next year. So I didn't want to overthink it and put loads of effort into saying like, oh, okay, what should I put on a situational judgment test? Blah, blah, blah. And it depends on the person. That worked for me. When it came to personal statement, I know now that there's a specific person specification that when you write a personal statement, you need to sort of include certain things, certain phrases and words and whatever that will flag up and be like, okay, yeah, tick, 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 this person suits it. But quite honestly, I sat down for about 2 hours, just wrote it just what I was thinking, and it worked out. I think that sort of organic approach might prove to someone that they really want to do it, which is good. But at the same time, having more preparation than I did is probably a good idea. I just sort of sat and just wrote, and I read it back, thought, you know what, I'm happy with this. This reflects sort of who I am and why I want to do this. So yeah, when it came to situational judgment test, I know a lot of people that are medics or were medical students, and they do a bunch of these and that sort of style of test. So I talked to them a little bit. That was quite useful. And they mostly just said to me, oh, Mario, just use your common sense, which I mean, it helps, but it's also important to read about sort of NHS constitution, NHS's values, to sort of make sure that what you're thinking is on the right lines, because classically with multiple choice questions, they can be very similar, and you want to think, okay, I've got my what I would do hat on, but I've also got what would a registered clinical scientist in the NHS,
Yeah.
what would an NHS employee be expected to do in line with further training that they'll get. And so yeah, that really helped. Going on to, do you want to go on to interview?
Yeah, the interview.
Yeah, so I mean, after everything, long list, short list, you pick the locations. So I got interviewed by the head of my training consortium, who's now my line manager, technically, and also someone else, like another senior clinical scientist. I think that it's changed and changed back a few times from being interviewed by your employer or being interviewed by someone from somewhere else in the UK. Like, it's changed a few times, but they obviously asked some personal questions and whatnot. They asked a few semi-technical questions. It wasn't things like, okay, I'm applying to be a trainee physicist. They weren't asking me what is like the speed of light or something like that. They were asking me equations. They weren't saying, yeah. They weren't like saying, can you list Maxwell's equations in
Oh yeah, yeah.
But they were asking me things like, oh, okay, if a patient has a pulse, if you're performing an exam with a pulse oximeter, and what are the potential errors for a reading? So it's like, as a scientist, it's like you need to be identify potential errors and mitigations and things like that. Then they'll also ask a few more general questions, like how to increase inclusivity and diversity, or basically to foster a good culture of that, sustainability and things like that. So you will get one or two of those questions as well. Those are quite easy because I think if you share the values that they're looking for, you can basically just
Yeah.
make up an answer on the spot and you will be correct. So that was great. I quite like those ones. And yeah, so I'm trying to think of what other technical questions. They will come from a bank, because I remember I spoke to other trainees and we got like one of the same questions each and then some different ones. Yeah, I think you can find them online though.
Yeah.
But they vary from center. They change every year, but it might be good practice to sort of look at it. I think you might get a source of errors question a lot of the time. I don't know if you did, but it seems like a fairly important thing. No, you don't. Okay. What else? Yeah,
Yeah. I
I don't
think
really remember. It was a bit of a blur.
getting past shortlisting is more difficult than the actual interview, because I expected the interview to be like very difficult, but it was fairly, should I say, straightforward and easy. It's just like, just read and prepare for it and you'll be able to answer the questions. But getting through the shortlisting, like competing with so many people, I think that is more difficult than actually passing the interview. So yeah, it was
Yeah, it seems like it was. I mean, don't get me wrong, it wasn't trivial. You still had to think, but I was like you, I thought it would be complicated. But at the end of the day, it was more of a double check. Like, based on your application, it seems like you're a decent fit. Let's just actually talk to you.
yeah.
Yeah, I'm not really sure how they actually do the long listing and short listing and how they do rankings because it doesn't seem like you get enough information to be ranked nationally.
Yeah.
So I would say to people not to be disheartened based on rank and things like that because there's no good way to assess you like that based on what you give them. And yeah, I genuinely couldn't tell you how they do it.
I don't know how they do it as well. It's just like taking whatever you find there. But yeah, it's just what it is anyway, but that's fine.
That's yeah. Every system inherently has flaws, and hopefully, but yeah, I would just want to tell people not to be too disheartened based on rank, and also even at centers that are very competitive, it's not uncommon to have people on reserve lists that have high ranks that get jobs. I know lots of people that that's happened to, and they're in London, North London, South London, wherever, or they're in Oxford or wherever. So yeah.
That's fine. So I think the next question is going to be about how you're balancing the STP because of course it's very intense. I don't know how you are finding it, but for me I actually feel it's very intense. There are a lot of expectations and it's not like it's difficult. It's just that there are so many things I need to do and I need to learn as well. So how are you finding it and how are you balancing the STP?
Yeah, I mean, personally, I'm fine. I think I have a lot of advantages that others don't in my situation. Whereas I live at home, I don't have to do chores every day and things like that.
Okay.
There's things like that. It sounds silly, but it makes my life a lot less stressful. So that
That's
when I'm doing, I work, obviously I work full time. I probably do a little bit more than full time. That is not because I'm forced to or because I have my training officer and supervisors saying, oh, I need this done by now. It's because I'm working on something. It hits 5, half 5. I'm still enjoying it. I'm still into it. I'm still going. That's I find it okay. Just like I've only had a full-time job before at that internship, and that was a very relaxed sort of startup environment. So I'd say it was probably more difficult than that, especially as I have more responsibility. But yeah, I'm finding it okay, to be honest. I would say it got a bit intense when your day-to-day work overlaps with university. So in my case, they put some of the originally third year stuff into second year. I had about 2 months worth of lectures and I had other stuff to do as well. When I went back to work, I had coursework to work on and then an exam. So I didn't have much time to do my coursework and my exam work alongside everything else. So that was pretty difficult. That was a difficult 2 months, but I'd say when those two worlds intersect, that's when it can be a bit stressful. But especially in centres that have had loads of trainees, they know how it is. A lot of them went through it themselves. I think generally you get supported fairly well.
yeah.
Yeah.
I agree with the part of getting supported because for me, when I have to take exams, it gets really stressful for me because we have loads of resources and we have a lot of reading to do. So yeah, I agree with the support because I just speak to my training officer. I think I'm struggling with this a bit. I might need more time to study for exams. Yeah, if you need more time, just take more time and study. So I find that part really, really helpful because I just like have to focus on the exams and when I'm done, I'm just back to work to catch up with that. So yeah, I find that part really good about the STP.
Yeah.
So what is one thing you wish you knew before you started the STP?
I think for a little bit.
If you can't think about anything, it's fine.
No, it's a good question. I feel like I should answer it, but I'm sort of blanking. I think I think having some previous clinical work experience would have been very useful because it was basically the first time I've been in a hospital without being a patient or supporting someone. So I wish I would have known how to sort of interact with people on that level. I found it a bit strange working in a hospital because I think sometimes I was like, oh, I'm working in a hospital. I need to be like solemn, like everyone here is ill, sort of thing. It's not the case. You can be happy, you can be joyful. Um, but yeah, like navigating some of those scenarios, I think, is something I would have liked to would have liked to know and probably would have benefited from. Um, don't really know. Don't
Yeah.
really know what else to
But
be.
talking about that, your role is patient facing.
Well, I mean, not really. This thing in medical physics, you have nuke med, which is probably the most patient facing, then radiotherapy is quite patient facing. MRI is like third. You might have to, when you have an implant patient, you might need to help. You might need to help talk to them and explain risks and benefits and things like that. Or you might be there for scans. You might see a patient, interact with them, but you're not. really delivering treatment and stuff. It's not very patient facing, but
Oh,
you can interact with them sometimes. So yeah, also depends on the department as well and their way of working.
yeah. Okay. So, I'm gonna ask you for two advice. So, advice for persons that are starting the STP, and advice for persons that would be applying for the STP next January.
Yeah. Okay, I'd say for people starting the STP, I'd say don't worry about the intensity. At risk of getting trouble with the national school, when they do their inductions and things like that, I think they try and scare you a little bit and say, "Oh, it's gonna be very, very difficult. Your life is gonna end. Basically, it's gonna be oh, it's fine. You'll be fine."
Okay, I think I like that advice. It's
That
not
is
as bad as it seems.
I don't know if you felt that way, but I felt like the national school was sort of trying to scare us a little bit, which is fine. I mean, they just want us to work hard, which is perfectly valid. But I would say to people starting the STP, carve out time for yourself to pursue when you're very interested in something. I I'm on rotation in nuclear medicine. I'm watching SPECT scans. I'm writing observations and reflections on SPECT scans. Oh, I saw a cardiac amyloidosis SPECT scan. I'm so interested in that. Spend some time looking into it, talking to people, and you really need to learn how to be proactive. I still am not the most proactive person because I'm a bit shy when it comes to going up to people, especially a lot more senior than me, and talking to them and asking for things. But it's a skill that you really, really need. It's possibly the most important skill that you can have as a trainee. So I think there's that. For people applying, I already said don't get too disheartened on rank and things like that. I'd say personal statement, do look into person specifications on job descriptions and try and tailor them. But at the same time, try not to be too robotic, like properly express yourself. Yeah.
Yeah.
And don't
Yeah.
use ChatGPT because the writing, I don't know about you, but I find outputs from generative transformers to just be really robotic sounding. And I don't know, just express yourself in a way, even if it's not the most beautifully written, grammatically excellent thing ever. They're looking at what a person is on the other side of it,
Yeah.
rather than whether they're Jane Eyre or Margaret Atwood. So yeah, I think that's
Funny how I just had this conversation with a friend yesterday. She was getting ready for an interview, and I think they had like set of questions they are expected to provide answers to. I'm like, I don't think you should sound perfect and like sound very robotic, like you said. I think you should just sound normal. You might not know that might just be what they want to see. Unlike, I don't know, trying to create that perfect picture and all that. You might just be yourself sometimes.
yeah.
So
It's
I like
it's
that one.
it's an issue. I think it's a general issue with applying for jobs that you want something so bad and you're trying to do everything so perfectly that you forget that you're a person.
Yeah.
It's silly. Yeah. Also, I said Jane Eyre, I meant Charlotte Bronte. But yeah. Anyways. Yeah. So top tip: remember you're a person. Obviously, that's
Yeah, that's fine. I think we've covered all the questions that
okay.
I have for you this morning. So yeah, thank you so much, Mario. Thank you for doing this.
Thanks for having me. Thanks for doing interviews with people and widening access and helping people. It's brilliant and it's very useful. And if you're watching this, then you're very lucky to have Cynthia.
Oh, thank you for contributing to that. Coming here, of course, yeah, you've also helped persons that are looking at going into MRI and non-ionizing. And I've learned a few things. So yeah, now I know that it's your specialty is not as scary as it sounds. So it's actually
Yeah.
interesting. Yeah,
Yeah.
thank you very much.
Yeah.
Okay.